Burnshield Emergency Burn Care can be used on all types of burns and immediately cools and soothes the burn by absorbing and dissipating the heat. In an emergency situation, ensure your own safety before attending to the patient. Only then remove the patient to safety. Remove tight or restricting items from the burnt area, for example, clothing and jewelry. Do not remove anything firmly stuck to the burnt area unless it is still hot or smouldering. Do not break blisters or disturb the burnt area. Do not apply toothpaste, fats, grease, butter, or oil-based items onto the burnt area. Do not use ice or iced water on a burn, as this can cause further damage. Apply Burnshield to the affected area. When using a Burnshield hydrogel, apply the gel to the wounded area and go beyond the surface area of the burn. When applying a Burnshield dressing, open the foil package. Remove the dressing and apply the dressing to the wounded area and beyond the surface area of the burn. Secure with a non-absorbent bandage. Keep applying the hydrogel to avoid the wound from dehydrating for 24 to 48 hours. The hydrogel can be applied on top of the dressing and secured. Depending on the size and depth of the burn, seek medical help. Burnshield cools and soothes the burn, minimizes skin damage, is safe for use on children, non-toxic, non-irritant, non-adherent, and has a shelf life of 5 years from date of manufacture. Have peace of mind with Burnshield nearby.